Can CBD cause psychosis? Have you ever wondered if cannabidiol, commonly known as CBD, can lead to psychosis? This question is important, especially with the rise of CBD products in the market. Let's break it down. Cannabidiol is a compound found in cannabis plants, but it is different from tetrahydrocannabinol, or THC, which is the main psychoactive ingredient in marijuana. While THC is known for producing a high, CBD does not typically create intoxicating effects. In fact, research suggests that CBD may help reduce psychotic symptoms rather than cause them. Studies have shown that CBD might even have antipsychotic properties. For individuals at high risk of psychosis or those already experiencing psychotic disorders, CBD has been found to improve symptoms. Clinical trials indicate that short-term use of CBD is generally well tolerated and does not lead to significant adverse psychiatric effects. Some research even suggests that CBD could counteract the psychosis-inducing effects of THC. However, there are some important points to consider, especially regarding substance abuse and addiction. Some CBD products, particularly those made from hemp flowers, can contain small amounts of THC. This can happen due to mislabeling or a lack of regulation in the industry. If someone consumes a large quantity of these products, they might ingest enough THC to experience intoxication, which could lead to psychotic symptoms. For example, there was a case involving a 17-year-old who developed psychosis after using a CBD product that actually contained enough THC to cause intoxication. This situation highlights the risks associated with unregulated or mislabeled CBD products, particularly for adolescents or those with vulnerabilities. When we look at substance abuse and addiction, the risk of psychosis is more closely linked to THC rather than pure CBD. Marijuana-induced psychosis is a recognized condition that arises from the psychoactive effects of THC, particularly when high doses or potent strains of cannabis are involved. Since many CBD products on the market are not strictly pure and may contain varying levels of THC, users should be cautious. In practical terms, here are some key takeaways. Pure, pharmaceutical-grade CBD is unlikely to cause psychosis and may even offer protective effects against psychotic symptoms. However, products labeled as CBD may contain THC, sometimes at levels high enough to induce intoxication and psychosis, especially if consumed in large amounts. Adolescents and individuals with a history of psychosis or substance use disorders should be particularly careful with cannabis-derived products, including CBD. Regulation and standardization of CBD products are essential to minimize the risk of unintended THC exposure and related psychiatric effects. In summary, CBD alone does not cause psychosis and may even help reduce psychotic symptoms. However, the presence of THC in some CBD products can lead to marijuana-induced psychosis, especially when consumed excessively or by vulnerable individuals. Understanding these distinctions is vital for anyone considering the use of cannabis-related substances.